Hey everyone, it's Joe and welcome to another lecture for Module 3. This is lecture 1.5, I believe, and we're looking at the fundamentals of radiobiology. In this lecture, we're going to be talking about radiation dose-response relationships, or dose curves. And these are really easy once you get to understand them. There's a little bit of memorization, but it's really understanding the mathematical relationship between dose and a response within the body. Now, all of this has been the result of us studying radiation and radiobiology ever since we've had atomic weapons back in the 1940s. And so when we put these studies together and we crunch the numbers and we look at how a person responds to radiation, we're able to graph certain things. And there are certain graphs that you need to memorize that are important for you to understand, as well as for passing that registry exam. Now, when we're talking about the human responses to radiation, we kind of break it up into this or that. And there's a few of them to consider. The first one is, are there early signs of radiation sickness or early signs of radiation exposure or late signs of radiation exposure? So early would be, do we see some signs or symptoms right after the exposure? Or does it take months or even years to see a change from that exposure to radiation? The next thing to consider is this a high dose of radiation? Or is it a low dose of radiation? So the amount of exposure to the person will also determine the outcomes or the human's response to that exposure. And finally, you've got deterministic or stochastic. Deterministic types of symptoms are those that we can predict. We know that they're going to happen. If a person gets exposed to a certain amount, or if the whole body gets exposed versus a certain part of the body gets exposed, we can determine what that symptom is probably going to be. Stochastic is by chance. If a person gets exposed to radiation or gets a good dose of radiation at one point, will that develop into some type of cancer or leukemia down the road? And so we're not able to predict it. And so that is more of a stochastic type of event. And so those are the things we look at. Early versus late, high dose versus low dose, and is it deterministic or stochastic? And these are the different curves that we have to understand. Now, this is an important slide because there are some patterns that you should know of. Whenever we deal with deterministic types of radiation responses, it's usually from a high dose, and it's usually early response. Okay, and a good example of that is if we have our C-arm and the tube is plastered up against the side of the person's body rather than having the image intensifier close to the body, and we keep hitting that exposure after exposure after exposure, we're going to cause most likely a burn, some type of erythema to that person's skin. And so we know that that's going to happen, and it's usually because it's a high dose, it's going to happen pretty quick after the exposure, and we know that it's going to happen, so it's deterministic. Now, stochastic responses such as a cancer, leukemia, any type of genetic effect, that is usually studied or usually followed with a low dose of radiation exposure, and it's usually a late response to radiation. So deterministic is high dose and early response. Stochastic is usually a low dose with a late response. Now, one thing you should know is that with both deterministic and stochastic, that with deterministic, as the exposure increases, so will the response. So will the deterministic radiation response be also increased. So in other words, if you keep hitting that button and the person's in that X-ray tube is right up against the person's body using a C-arm, and you keep hitting the exposure, as you increase the exposure, the burn is going to get worse. All right, so it's going to make a worse burn, a higher burn. With regards to stochastic, the longer that person is exposed to that low dose of radiation, the longer the time interval is with that low dose of radiation, the higher the chances are that they are going to have some type of cancer or leukemia or genetic effect. So, now before I show you these different graphs, there's a couple things you need to know. And it's basically the basic nomenclature around them. The first thing is it linear or is it nonlinear? Now, linear means it's a line. So you can see the word line in linear. Is it a line? And if it's non-line or non-linear, that means there's a curve to it. So that's the first thing you need to know. Is it linear? Is it a line? Or is it a curve or a non-linear type of graph? And so that's one thing you need to know. The second thing is there a threshold or is there no threshold? And what that means is a threshold means that your body doesn't show any signs and symptoms until it reaches a certain level of radiation. In other words, when you give a chest x-ray, we don't give the person erythema right away. They don't have redness of the skin just from a chest x-ray because there's a threshold. The body can tolerate that much x-ray, and you're not going to see any deterministic effect with a regular chest x-ray or ankle x-ray or abdomen x-ray. There's a threshold, okay? Non-threshold, however, says, well, wait a minute. Even though we don't see erythema, we don't see that burning, we know for a fact that x-ray is penetrating the body and affecting the cells within the body. So you could argue the fact that really whenever anyone is exposed to x-ray, there is a non-threshold dose because cells are being bombarded by the x-ray and it's hitting the DNA, it's hitting the cytoplasm, so there is some biological damage. So that would be a way of thinking in a non-threshold way. So even one x-ray photon hitting a person's body is going to cause biological damage, where a threshold argument would say, no, you can have so much x-ray to the body and it will still regenerate, it'll still be okay, it'll still repair itself without any problems going forward. So when we look back at deterministic and stochastic, deterministic responses usually show some type of threshold, okay? And stochastic responses usually show no threshold. So things to think about. And let's take a look at these graphs. All right, let's take a look at some linear dose-response relationships. So here we have a graph, and I want you to pay attention to A and B. C and D, forget. Don't worry about them. So for now, I want you to look at A and B. First of all, these are linear. You know why? They're a straight line. That's all you need to know. It's linear. Now, as far as threshold and non-threshold, just to show you as an example, whenever a line is on this vertical line, okay, that means that there is no threshold. All right, so if down on the bottom is your radiation dose, and here on the side is your response, all right, just by going up one little tiny bit, and you're automatically going to get a response. The line or the graph is automatically going to increase as you increase the radiation dose. Okay, so if it's on this line or if it's tucked in the corner here, that means there's no threshold. Whenever a line or a curve, a nonlinear line, I guess, starts to the right of this corner, then that means there's a threshold. But whenever there's anything that has no threshold is involved, it's not a linear line. So we only care when we're dealing with a linear dose-response relationship, we only care that it's non-threshold. All right, so let me continue. So looking at the same curve, let's talk about the two that we care about. Again, right here, there's no threshold linear graphs that we care about in diagnostic x-ray. So forget about C and D. Let's talk about A and B. Let's talk about B. B is probably the most important graph you need to know because this is the graph that designates for ALARA, as low as reasonably achievable. ALARA. That means that you shoot one little x-ray photon, there is a biological response. And as we increase the amount of x-ray photons that we throw at a person, it's going to increase the response as we increase the radiation dose. And so ALARA believes that even if it's just one x-ray, that one little x-ray photon is going to cause biological damage. And so this is the graph for ALARA. Okay, it is a non-threshold linear dose response. Let's look at A. A is for a graph that we would consider for someone who has cancer. We know that people are going to get cancer, all right, even if they've never ever had an x-ray. There are lots of reasons for cancer, whether it be a genetic, whether it be where they live, whether it be things that they eat, whatever. There are other reasons to get cancer besides having an x-ray. So that's why the response is up here. But since it's on this vertical line, we know that as we start increasing the amount of dose just by a little bit, the response to cancer is going to go up. We know that if a person receives more and more radiation, the chances of cancer are going to increase as well. And so that's what this is. But this is also considered a non-threshold. Okay, as soon as you give one little X-ray photon, you've just increased that person's chances of getting cancer. So that's what the linear dose response is with no threshold. And that's what we care about. Let's talk about ones with a threshold where we do care about it. All right, let's look at some nonlinear dose-response relationship curves. So with these types of curves, you notice that the lines are no longer straight. They're nonlinear, non-line. So these are all going to have curvy or wavy lines to them. And you can see that we have both non-threshold and we've got threshold. So the funny thing is, though, we really only care about those with a threshold now. So if it's a non-linear curve, we really only care if it has a threshold. We really don't deal with any types of curves in diagnostic X-ray that are non-threshold and non-linear. So you don't ever have to worry about that as being an answer in any of your questions. Now this C curve is what we are interested in. This here represents any deterministic type of reaction. We know that things like erythema, epilation, the formation of cataracts, we know that they will happen if you give enough dose or if you're under exposure for a long enough period of time. So as the radiation dose increases, all right, we're eventually going to get to the point where you will start to burn the skin, okay, where hair will start to fall out, cataracts will start to form. And usually it is this type of curve, especially for erythema, where if you've already started, if you get to the point where you start to burn, is a little bit, it's kind of slow at first, but as you start to burn on top of a burn, I don't know if you ever had a sunburn and then you went back out in the sun, you feel it because now it's really, your cells are really unable to protect you from that sun, or your cells are unable to protect you from that radiation, then the burn on top of the burn is just going to intensify greatly. And so that's what C is reflected of here. And then you generally have this plateau at the end because, you know, once you've reached a 3rd degree burn, it's hard to burn anymore. That's as burnt as you're going to get. So, you know, this here represents what we are interested in as far as X-ray techs, that we know there's a threshold. We know that it's going to take a certain amount of X-ray to generate a response. Once we get that response, it may have this curve that's pretty dramatic and straight up, and then it will eventually kind of plateau itself off. So this is epilation, this is erythema, this is cataract genesis. That is what we're interested in. We're not interested in A or B. So in wrapping up, as a diagnostic radiographer, we are concerned of the late effects of radiation. We are really interested in that linear, non-threshold dose-response relationship because that is a LARA. We know that that one X-ray photon can cause some biological damage. We know that what we are doing with patients, with the amount of X-ray that we use and how we use it, we're really not going to get a deterministic response. We know that there has to be a certain amount of distance between the X-ray source and a patient in order to use it properly. We know to use the shortest exposure time as possible. We know that we're not going to give a whole body dose of radiation. So deterministic effects are relatively rare when you consider how to use the equipment and use it properly. So our concern happens to be more of those late effects where even just a little bit of dose, just a little bit of X-ray to the person's body is going to cause some type of biological response. And of course, as I've mentioned, I'm trying to drill this in your head, a LARA, okay, as low as reasonably achievable, is designated or represented by a linear non-threshold dose-response relationship. And if you remember that, you're good. And lastly, what I've done is I have a dose response curve guide. It's in Blackboard. You should see it there. Just download it and study it. And again, it looks at these different, the different curves that we've talked about. And you can see here are the old pictures. So A and B, this is what we're looking at. ALARA, stochastic effects, leukemia, cancer, all of those things. That is your linear non-threshold. All right. C and D, linear threshold, nothing. Not applicable. We don't care about C and D. So this is what's going to be represented here. And that's how these questions are going to be asked. Cancer effects, genetic effects, leukemia is which dose-response relationship curve, and you need to say that it is a linear non-threshold curve. All right, with regards to non-linear, non-threshold, yeah, we could talk about chromosomal aberrations, multi-hit. I'm going to discuss that in another lecture, but it's nothing you really need to worry about. It's not going to ask you that. But C, non-linear threshold response curve, C, that's where you get your skin effects of radiation, erythema, epilation, cataracts. We're going to talk about these different syndromes later, but as far as you know those, you should be all set. So download this, study it, and this will help you in a lot of your registry questions. And that is it. I know I went well over, but this is it for this week. So this is enough to get you going. I'm going to send out an email letting you know that we are going to extend one more week for this Module 3 test, and I'm taking off a week with regards to the medical law and medical ethics segment. So I'll mention that in an email. But if you have any questions about this, if you have any comments, please send me some emails. Let me know, and I'll be happy to answer any questions you have. Good luck. I'll see you all on Friday, and take care.